Okay, today we're tackling one of the most exciting and, let's be honest, one of the most confusing areas in modern medicine, regenerative therapies. You've probably heard all the buzz about stem cells and PRP, right? They get talked about like these miracle cures for everything from a bad knee to chronic back pain. So, what's actually real and what's just hype? Let's figure it out.
Really? It all comes down to this one really powerful question. What if the most advanced pharmacy in the world isn't in some lab, but it's actually been inside your own body this whole time? That is the revolutionary idea we're going to explore today. So, what is all the excitement about? To really get it, we first need to understand the incredible promise of this whole new frontier in medicine.
At its very core, this is what we're talking about. See, regenerative medicine isn't about just masking pain with drugs or trying to temporarily knock down inflammation. It is a huge shift in thinking. It's all about aiming to heal damaged tissues and treat the root causes of a disease. It's about actually rebuilding. And this really gets to the heart of why it's such an appealing alternative. For years, right, a common treatment for joint pain was steroid injections. But now we know that over time, those can actually be toxic to your cartilage. Regenerative medicine offers a totally different path, harnessing your body's own healing power to fix the problem, not just, quiet it down for a little while. So let's go ahead and open up that repair kit. We're going to look at the two main tools everyone's talking about: platelet-rich plasma, or PRP for short, and mesenchymal stem cells. And don't you worry, I promise to keep the biology simple and the ideas really, really clear. Okay, first step is PRP. The main thing you need to know here is that it's what we call an autologous product. That's just a fancy medical term that means it comes directly from you. We're basically taking the healing stuff that's already in your blood and concentrating it into this powerful injectable serum. And the whole process is surprisingly simple. A small blood draw, just like a routine lab test, gets put into this machine called a centrifuge. This thing just spins the blood super fast, which separates it out into layers. Then the doctor carefully takes out that golden platelet-rich layer and injects it right where your body needs it most. So what does it actually do when it gets in there? Well, the best way to think about it is like this. Those concentrated platelets are just loaded with growth factors. When they're injected into an injured spot, it's like sending this massive, highly motivated construction crew to the site. And they don't just patch things up. They send out all these signals to the body to start building new tissue, form new blood vessels, and just kick off a really powerful healing response. Now let's talk about the other major player, mesenchymal stem cells, or MSCs. These are basically the master cells of your body. They've got these two amazing superpowers. They can make more of themselves through division, and if the conditions are right, they can turn into all sorts of different specialized cells. Now, this is where we need to clear up a really common myth. We used to think that stem cells worked by just turning into new tissue to replace the damaged stuff. But what research is showing us now is that their main power is actually something called the Paracrine effect. So think of it this way. They're the foremen on the job site. They don't just become the new cartilage themselves, they release this whole cocktail of powerful signals that basically manage the entire healing environment. They're telling your own cells how to repair the damage. They're like the conductors of a healing orchestra. Okay, so the promise is obviously huge. But you know what? Promises don't fix chronic pain. Evidence does. So now we've got to ask the tough question. Does this stuff actually work? Let's just start with a dose of reality, and this comes straight from the source material. The clinical evidence is mixed. Now, this isn't necessarily because the treatments don't work. It's often because the way studies are done, the protocols, the type of cells they use, the dosage, it all varies like crazy. And that makes it really hard to compare results and say anything for sure just yet. So to try and cut through all that noise, it is time for us to enter the evidence corner. This is where we break down what the research is actually saying into a clear bottom line for you. Let's kick things off with a really promising example. This is data from what's called a randomized controlled trial. That's the gold standard on knee osteoarthritis. Okay, so the graph on the left, that's pain scores. The one on the right is function. The blue line is just standard exercise therapy, but that orange line, that represents a single stem cell injection. I mean, look at that difference. The stem cell group had this dramatic drop in pain and a huge jump in function that actually held up for 2 whole years. This is the kind of data that gets researchers really, really excited. All right, so let's zoom out and look at the big picture.
Right now, there is what we call level 1 evidence. That's the best kind that supports using PRP for tennis elbow. For stem cells, the data is looking super promising for things like knee osteoarthritis and pain coming from degenerated discs in your back. But for a lot of other problems, like using PRP for Achilles issues, the data is all over the place. Some studies show amazing results and others show, well, no real benefit. The science is still playing catch up with the hype.
So, if you're the one dealing with chronic pain, what are you supposed to do with all this information? Well, this next section is all about empowering you so you can have a really productive conversation with your doctor. Let's just quickly go over a few key terms you might hear. Autologous, remember, means the cells are yours. Allogeneic means they're from a screened donor. And don't forget that paracrine effect. That's how stem cells act as those healing foremen. Just knowing what these terms mean helps you understand exactly what your doctor is proposing for your treatment. And here's the most important point. Being an informed patient is your greatest asset. The whole goal of this explainer isn't to tell you whether you should get these treatments or not, but to give you the tools to discuss them intelligently with your doctor. And that brings us to our final and maybe most important part, the doctor's note. This is your one single actionable takeaway from this entire discussion. When you talk to your doctor, these are the two questions you absolutely need to ask. The first one takes the conversation from general hype to specific evidence for your exact diagnosis. And the second one is so important because, as we've learned, the protocol, how the cells are prepared and delivered, it matters a ton. A good doctor should be able to answer both of these questions clearly and with confidence. So we'll end with this thought. While the evidence is definitely still evolving, the basic promise here is just so powerful. It really represents a shift toward healing from within. And as science keeps unlocking the secrets of our own bodies, it really makes you wonder, could the future of medicine already be inside us, just waiting to be activated? Thanks for joining us.